Dear listeners, we are happy that you are interested in the application possibilities of electrical stimulation in the clinical practice of physiotherapy. All the information on the slides was prepared during the implementation of the European Union funded Erasmus Plus project, which is called Clinical K for Electrical Stimulation. The leading partner of this project is University from Turkey, Pamukkale University. Other partners from Turkey are Başkent University, Hatay Mustafa Kemal University, Süleyman Demirel University, Budur Mehmet Akif Ersoy University. Also, we have partners from Romania, it's University of Craiova, and from Lithuania, Šiauliai State University of Applied Science. In this project, actively participate the all partner countries physiotherapy association, so it's from Turkey, Romania, Lithuania, and Estonia. So I want to introduce to Module 3 electrical stimulation for healthy muscles and its subtopic strengthening of healthy muscles. This subtopic was prepared by physiotherapists Dovydas Gedrimas ir Vaida Aleknavičiūtė. In introduction, neuromuscular electrical stimulation involves the application of a series of intermittent stimuli to superficial skeletal muscles with the main objective to trigger visible muscle contraction due to the activation of intramuscular nerve branches. Electrical stimulation is generally delivered using one or more active electrodes positioned in proximity to the muscle motor points and pre-programmed stimulation units. An intact motor nerve is a prerequisite for a lifting muscle contraction with a neuromuscular electrical stimulation. Depending on the stimulus status of the muscle being stimulated, neuromuscular electrical stimulation can be used for preservation of the muscle mass and function during prolonged period of disuse or immobilization. The second part is for the recovery of muscle mass and function following prolonged periods of disuse or immobilization. And the third way is for the improvement of muscle function in different healthy populations. It could be elderly subjects, adult subjects, recreational and competitive athletes, and also as a pre-operative strengthening modality. It is pre-rehabilitation. Now let's talk about a little bit about strengthening of muscles in adults, healthy muscles in adults. Usually, healthy muscle stimulation is performed in athletes or in the rehabilitation settings, for example, to prevent disuse muscle atrophy or to supplement exercise program for faster muscle mass and strengthening gains. It has been largely acknowledged that the neuromuscular electrical stimulation is a relevant tool resulting in increased maximal isometric voluntary strength. In healthy subjects, adaptation of muscle physiology is observed when repeated electrical stimulation is used, such as during muscle training. An increase occurs in the cross-sectional area of type 1 muscle fibers of the overall muscle group that was trained. This is associated with an increase in the amount of the type A isoform of heavy chains and myosin and increases the voluntary contraction is combined with the stimulation. These alterations depends on the type of stimulation used and could be parallel with improvement maximal strength of the trained muscles and higher muscle electrical activity. There is a lot of evidence that electrical myostimulation has an impact on strength gains. Rugby players, for example, isolated stimulation of the quadriceps femoris, gluteus maximus, and triceps surae muscle during a 12-week period leads to a marked increase in the strength power of these muscles. Electrical stimulation in healthy subjects and athletes looks more like complement to classical strengthening programs, particularly in combination with the simultaneous voluntary contraction. It's made advanced are to increase the muscle workload as a complement to classical training and to induce a contraction patterns different from the patterns during voluntary contraction. Russian currents can be used for muscle strengthening in athletes. The frequency used is around 2500 Hz. Each burst of electrical stimulation lasts for short duration, usually between 10 and 50 milliseconds. The bursts are delivered in trains with a frequency of around 50 bursts per second. The Russian current is usually applied with a duty cycle of 1 with 5, which means the stimulation is on for 5 seconds and off for 20 seconds in each cycle. The amplitude or intensity of the electrical stimulation should be set to a level that induces visible muscle contraction, but it should be comfortable and tolerable for the athletes. Strengthening of healthy muscles during the limb immobilization period. Electrical stimulation is used during and/or after the immobilization period alone or is associated with a voluntary muscle contraction. Knees are usually immobilized after surgery or severe traumatic lesion, such as anterior cruciate ligament ruptures. In this situation, amyotrophy and strength loss appears rapidly in the quadriceps femoris muscle. Numerous clinicians use direct muscle stimulation to limit the appearance of these muscle changes and accelerate the person's return to normal functional level. The main result of stimulation is less reduction in muscle strength in patients receiving electrical stimulation during the disuse period. Strengthening of healthy muscles during the limb immobilization period. Faradic currents can be used during this period. Typically, the low-frequency electrical stimulation is used during the limb immobilization. Frequencies in the range of 1 to 50 Hz are commonly employed. The pulse duration is usually set between 200 and 400 microseconds. The intensity of the electrical stimulation should be adjusted to a level that induces muscle contraction. It should be strong enough to elicit muscle responses without causing discomfort or pain to the individual. Common duty cycles include 1 with 1 equal on and off time or 1 with 2 stimulation on for 1 second followed by stimulation for 2 seconds off. The duration of each electrical stimulation session can vary based on the specific treatment plan and individual needs. Sessions typically range from 15 to 60 minutes. Strengthening of healthy muscles during affection leading to cachexia and extended bed rest. Cachexia is characterized in particular by disuse amyotrophy and a mere decrease in muscle force. Also, a positive effect is indicated of muscle electrical stimulation associated with active exercise on the duration of the bed rest time in patients with chronic respiratory insufficiency who need mechanical ventilation. Strengthening of healthy muscles during affection leading to cachexia and extended bed rest. The basic stimulation protocol for healthy muscles consists of warm-up phase, which takes 5 minutes, 5 Hz and 250 microseconds. Then going stimulation period, which took 30 minutes, 100 Hz, 500 microseconds, 5 seconds on, when 0.75 seconds rise, 3.5 seconds contraction and 0.75 seconds falls and 10 seconds off. And cooling down phase, which consists of 5 minutes and 5 Hz, 250 microseconds. Physiotherapists should set the intensity of the stimulation to a level at which the full contraction of muscle is visible and slight movement of limb are present. The next topic is about strengthening of healthy muscles in children. Children differ from adults in many muscular performance attributes, such as size, normalized strength and power, endurance, fatigability, and recovery from exhaustive exercise. Electrical muscle stimulation for children is usually performed when there are neurological conditions such as cerebral palsy, where muscle control is impaired due to the central nervous system disorders. It must be mentioned that not all children tolerate electrical stimulation, and its effects sometimes electrical induced feeling of tingling is too irritating. When it is absolutely necessary to perform electrical stimulation, lower intensity may be a possible option, but it may not be sufficient to cause the muscle contraction. Strengthening of healthy muscles in children with neurological conditions. Studies have shown that functional electrical stimulation therapy can lead to the recovery of upper limb function, specifically improvement in dexterity, range of motion, and activities of daily life. Benefit of increased limb awareness and improved sensory function have been reported as well in children with cerebral palsy. Electrode placement is usually the same for the muscle stimulation in children as recommended for functional electrical stimulation electrode placements in adults. One electrode is placed on the organ of the muscle and the another one is placed on the motor point of the muscle. The intensity of the stimulation should be reached a motor threshold when the muscle contraction starts. It must be mentioned that not all children tolerate electrical stimulation and its effect. Sometimes electrical induced feeling of tingling is too irritating. When it is absolutely necessary to perform electrical stimulation, lower intensity may be a possible option, but it may not be sufficient to cause the muscle contraction. Another option may be to use an anesthetic cream on the skin before this stimulation. When using electrical stimulation for lower limb function improvement, pulse width should be the set of maximum of 300 microseconds. Frequency set on 33 Hz. This type of stimulation can be used every day during walking activities. These parameters can be used for quadriceps femoris or ankle dorsiflexion muscle stimulation during the standing phase if it is necessary. Upper limb stimulation is usually performed for wrist, hand, and finger control. Neuromuscular electrical stimulation should be applied with, first of all, tolerable and comfortable density. It's about 20-25 milliamperes. The second, pulse width of 300 microseconds. Frequency of 30 Hz. On time, 12 seconds includes a ramp up of 1 second and a ramp down of 1 second, and off time for 5 seconds. In order to achieve maximal contraction, the wrist and fingers when applying neuromuscular electrical stimulation, the child should be in a sitting position with the elbow, forearm, and hand on 90 degrees of flexion, pronation, and neural position respectively. Talking more about strengthening of healthy muscles in children with neurological conditions, it is important to mention that Garzon with co-authors in 2018 published the article and they suggested intensity values according to the electrode size used for functional electrical stimulation. The bigger is electrode, the higher current intensity comes. So when using the electrode with sizes 1 or 3, the current intensity may be 2.7 milliamperes. When using the circular electrode, which is size, it's about 2.5 centimeters, intensity increased to 3.5 milliamperes. And respectively, if we use electrode which is size 5 on 5 centimeters, the intensity may increase till 7.9 milliamperes. And if we use electrode which size is 9 on 5 centimeters, the intensity of current may be increased till 10.6 milliamperes. Now let's talk about the strengthening of healthy muscles in children with orthopedic conditions. Quite common musculoskeletal condition in children is flat foot deformation, which usually occurs because of weakness of foot supporting muscles. It is recommended to use the electrical neuromuscular stimulation on plantar and stringed foot muscles. One electrode is placed on abductor hallucis muscle, largest cross-sectional area of the string foot muscles, while the other electrode is placed behind the head of the first metatarsal bone. The suggested current parameters for healthy muscles in children with orthopedic conditions are frequency 85 Hz, contraction time 5 seconds, and rest time 12 seconds. The ramp up and the ramp down times are 0.3 and 0.7 respectively. The current intensity should be adjusted based on individual tolerance without reporting pain or discomfort while standing on both feet. Strengthening of healthy muscles in elders. Skeletal muscle atrophy undoubtedly occurs with advancing age. According to longitudinal studies in people aged 75 years or over, muscle mass is lost at a rate of 0.64 till 0.70% per year in women and 0.80 till 0.98% per year in men. However, during periods in physical inactivity, skeletal muscle atrophy is substantially accelerated. For instance, data from immobilization and bed rest studies show a substantial 1 kilogram loss of muscle mass in 10 days. While there are several contributors to physical limitation with advancing age, one of the most prominent contributions is undoubtedly a reduction in skeletal muscle performance. Neuromuscular electrical stimulation is a fine tool to counteract the onset or aggravation of the sarcopenia process, activating the plasticity of the muscle tissue. It is commonly accepted that neuromuscular electrical stimulation can offer advantages over voluntary training for people who have limited ability or are non-compliant for volition exercises because of its promotion of specific motor unit recruitment. There is also evidence that neuromuscular electrical stimulation increases muscle strength, especially in periods with reduced mobilization. In order to prevent muscle atrophy in the elderly, electrical neuromuscular stimulation may be performed 3-5 times per week. Usually, the muscle stimulation of the lower limb is necessary to ensure good locomotion and balance skills. However, low upper limb and trunk muscles may also be stimulated with respect to muscle weakness and symptoms left. The main current parameters of electrical stimulation for elderly are pulse 75 Hz rectangular wave current, 400 microseconds pulse width, delivered with a rise time of 1.5 seconds, a steady tetanic stimulation time of 5 seconds, and a fall time of 0.75 seconds. Total duration of the contraction 6.25 seconds. The longest rest phase is necessary in order to delay the onset of fatigue. Thus, a rest interval of 20 seconds may be set between work cycles. Thank you for your attention. These are the references of the literature that we used in this model. Thank you again. Have a good day.